Unmute. There we go. Good morning to all of you.
Good morning.
First of all, let me start off with, I'm a white male, as Mr. Pretlow said, of a certain age. I have thinning dark hair, and I wear glasses. And I stand at the tall height of about 5'3". But at any rate, but I'm sitting down right now. So anyway, good morning. Look, we're here to talk about a very, very serious crisis. We need to make a real effort to look at new solutions. I can't suggest to you that all of the things I'm going to talk about right now are permissible under the present law, but I think we have to look at different ways of dealing with the problem. Right now, about 25% of the direct service jobs in the home healthcare industry and also in the OPWDD related services and in OMH and everywhere else, they're all vacant. We've got some, 100,000 vacancies in the state of New York. This is a major problem. Triage is no longer working. People are getting hurt. So I want to suggest that we take a look at a comprehensive approach. And I think we need some lawyers to look at this, and I would ask for your help to take a look at some of these suggestions. Number one, let's get some credentialing in. Let's make this a career, not a job. Let's find a way to have entry level, intermediate level, advanced level. Let's give some education standards, help people get educated when they're working in this job. Let's have some financial rewards for moving up and being in the industry for a while. Let's try to put together a package, a credentialing package. I'd like to do this in the OPWDD area. I think we can do it in home health care as well. Secondly, I think we got to figure out, can we find industry minimum wage, a Medicaid living wage, so we get around the problem of having to deal with the federal statute. Let's just pass a stat. I don't know if we can do this. I'd like us to explore it to see if we can do an industry living wage, 150% of the regional minimum wage. And lastly, I think we have to increase the pool of workers. I think we have to provide incentives. Maybe we can borrow some ideas from the immigrant worker programs and we come up with a light green card. So if somebody's in this industry, they get to stay in the country for 2-3 years, whatever. And maybe let's also look at au pair programs, bring people in from other countries. We do au pair programs for different purposes. How about trying it in this field? Let young people come in for a couple of years from other countries, learn the way we do things, get experience going back to their own countries. I think we've got to think out of the box. I think we've got to look at all of these different things. And I'm sure people out there have other ideas as well. We got to get together. We got to work on these things, see if we have to draft statutes, what's legal, what isn't. That's my suggestion.
Okay. Thank you so much, Assemblymember Avenatti.